split it up so much to where every body part has its own diagnostic section. So it gives you time to review and time to like, okay, what would I ask? And like, how would I ask it? Because usually the way I'll ask the diagnostic section in the final is your patient has a small confluent rash. And you'd say, oh, it looks like, or show you a picture, and you'd say, oh, that looks like a maculopapular rash. Okay, what organisms could it be? So this can be stressful coming up on the end, because flipping that around it's not a small task to do. So just make sure, I would do note cards is a great way to do it, and just repeat what organisms are for what disease. But I do think it's important, you know, it's like your patient is not gonna come in and say, I have Staph aureus, and you're gonna be like, oh, okay, cool. Here's all the things that tell you what Staph aureus is. Your patient will come in with some sort of rash, and you'll be like, is it bacterial? Is it viral? That's a good place to start. Okay, I think it might be bacterial because these are my clues. Okay, if I think it's bacterial, what do I know about Staph aureus? What do I know about strep pyogenes? So it starts giving you these little hints, you know, but having that first initiation of like, what could this be and how do I narrow it down from there? So, yeah, I think as we go through, stay on top of it, because when we go through cardiovascular and gastrointestinal, and you might get jumbled up easily. So if you have your note cards already ready to go and you feel confident with your note cards, then you can put those aside and get ready and do your next set of note cards. You have those, put those aside, get ready to do your next set of note cards. Then you'll have them all for the final. Then you can flip through for the final. Okay. So we just have a few more minutes. Does anybody have any more questions? Yeah.
Do you want us to know the specific names for the tinnitus?
Yes, and I can't remember 100% what I asked on the quiz. I wrote it a few days ago, but know the names of the tinnitus, especially for the final, and then what the names of the dermatophytes are, because that will be on the final. I didn't ask the names of the dermatophytes, I don't think, on the quiz. The whole foot, athlete's foot, is tinea pedis. So pedis, like we're bipeds. We have 2 feet. Pedis is feet. Tinea capitis is cap. The cap. Hopefully that one's easy to remember. Pedis is feet. Cap is scalp. And jockage is tinea cruris. I don't know if you have a way to remember cruris. C-R-U, isn't it?
C-R-U-R-I-S.
Cruris. There's an extra R, that's a funky R in there. So, tinea cruris is jockage. Tinea of the nails. Tinea unguium. This one's extremely common. You'll see it everywhere you go. Tinea unguium. It's also called onychomycosis. You don't have to know that for right now, but for the final. And then tinea, the worm, ringworm. Corporus. So there's, I don't know if what helps you remember that, corporus. Corpuscles in the skin, what helps you remember corporus? Pores, maybe? Corporus.
Like a giant circle pore.
Corporus. It's like a pore, the pores of the skin. Pore, maybe that helps remember. Yeah.
For like conjunctivitis, viral it's more clear.
Yeah.
But and then like bacteria is more like crusty looking, right?
Yes, bacteria will
Yellow.
be like drippy. Their eye can be sealed shut sometimes from the mucus. It seals their eye shut, especially in the mornings. Drippy, wet, super
That's bacterial.
purulent is bacterial. Dry, pain, red is viral. But it also can be clear fluid. Like a lot of times it's like looks like tears. It's just like watery eyes, but they're usually pretty dry and red. So that's conjunctivitis. That's also called pink eye. I think that was a good point. Sometimes I forget to mention like, oh, that is pink eye. That is what it is. Nervous system meningitis. Your patient might come in with headache, neck pain, sensitivity to light, confusion. It's a medical emergency. If you think somebody has meningitis, it's immediate trigger. If they have a rash, you can perform the glass test. So it's 2-second test that's easy to perform. That if you push up against the rash and the bump does not go away, it might clue you that it is meningitis. If the bump goes away, then you're like, maybe it's something else.
Can you get meningitis rashes from viral, bacterial, fungal, and protozoa, or is it?
You'll have a rash. You
specific?
can get a rash from anything. Oh, you mean can you get a rash from all of these?
Yes.
Yes, all of these can cause a rash. But
Rash.
It's not always either. It's just
Okay.
like these are some tools in the tool chest.
Okay.
So one of the tools is if your patient has a rash, perform the glass test. It's sometimes nice to even have that tool in the tool chest at home if it's your own child. Like, oh, I can perform the glass test. I know no matter what, we give them broad spectrum antibiotics because bacterial is so virulent.
Wait, and you said if the virus doesn't go away with the glass test, then it's more likely meningitis?
Then if the rash does not go away with the glass test, it could be meningitis, yes.
Okay.
Yes. And then, perform a lumbar puncture and test the cerebral spinal fluid to see if it has bacteria or viruses in the cerebral spinal fluid. Cause you're dipping right into the meninges. The meninges covers the brain and covers the spinal cord, and you're doing a lumbar puncture into the, subarachnoid space, pulling out that cerebral spinal fluid, and if it has bacteria or virus in it, then the patient has meningitis. Yeah.
The sequelae Zika virus was an encephalo.
Oh, encephalopathy? Yeah, so microencephalopathy.
Oh, microencephalopathy.
Yeah, so that's why they worry about pregnant women getting Zika, is because it's brain malformation. It's their brains are small, and their brain casing, their skull develops smaller around their brain. So they have like microencephalopathy. Anybody have any other questions?
Is rabies the one that causes
Zika is microencephalopathy. Polio is these are all nervous system, so they all affect the nervous system, but it affects the nerves and the neurons that attach to the muscles, and then the muscles become malformed, and the bones can even become malformed from poliovirus. Encephalopathy, acute encephalopathy is usually viral. Rabies is viral, but also can cause confusion, aggressive behavior, things like that. Tetanus is the chronic tension,
Seizing.
and then botulism is the
flaccid?
yeah, like
Paralysis.
yes, flaccid paralysis. That's it. Good. Okay, everybody sit one apart. Put all your stuff away. Who's on this one? So here was measles. So here's what you had to know for measles. So measles, that is the organism. It's called the measles, but it's also measles virus. So that one was, let's start with number 1. So number 1 was a vesicular rash. So here, let me show you what that looks like. So here, non-pus filled vesicles. So they're filled, but it's not pus, they're not neutrophils, it's just fluid. So a vesicular rash is varicella zoster, that was highlighted on here. And it's called a vesicular rash, so that was number 1. Number 2, the image, let me bring you the image up. Here, so that's a pus-filled rash. So that's a purulent rash. And the organism for this one is Staph aureus. So it looks like hair, there's hair, these little fluid-filled pockets. Leishmaniasis has like these giant gaping holes. So these are it's folliculitis, and they're little purulent rash. Number 3, this is ringworm. A lot of people got that confused and put impetigo. Impetigo is honey colored. Ringworm looks like this. So impetigo, let me show you what impetigo looks like. So this one does kind of look like a little bit like that, but I said that in the lecture. I don't know if that was very helpful, but anything that's honey colored. So here it says superficial honey colored, and then here honey colored. Ringworm. So that one is. So I'll probably take tinea corporis for that. But what I meant by the type of rash is a superficial or cutaneous mycosis. But tinea corporis is fine. And then disease-causing pathogen for those are the dermatophytes. So those are, if you put dermatophytes, that's okay. But if you put microsporum, epidermophyton, trichophyton, great. Okay, and then your 7-year-old patient has a fever, sore throat, and dry cough. So your patient comes in and you look at their throat because they have a dry cough and they're not feeling good. So you look at their throat. And their throat, you see Koplik spots. So you're like, whoa, let me look at her body or his body to see, do they have a rash? Do they have a concomitant rash? So are they have spots in their throat and they have a rash? That's going to help you think maybe it's measles. So that type of rash is the maculopapular rash, and the maculopapular rash is for measles. Okay, the next one, so the first one, so A for that was maculopapular rash, B was measles. Your 23-year-old patient has a rash covering a large portion of her torso. She has had severe headache the last 3 days. You do a rudimentary test to perform on the rash to see for appearing or disappearing redness. That's the glass test that you look for. We're looking for meningitis. What do you administer to your patient? You'd administer broad spectrum antibiotics, regardless if you think it's viral or bacterial, because viral is so deadly. And what sort of test would you perform? You perform a lumbar puncture. So you're looking at their cerebrospinal fluid. Put ELISA, whatever, lumbar puncture is kind of what I was looking for. Okay, the next one, your 3-year-old patient has a bright red eye, it's painful and swollen, and she wants to use antibiotic eye drops, but why would you say, maybe not? Well, it didn't say fluid, milky fluid. There's no drippy, milky, pussy fluid. So you would think it's viral, so you're like, maybe just wait a day or so and wait to use antibiotic eye drops. The physician would probably prescribe antibiotic eye drops and just say keep an eye on it. If it improves in the next day or so, if it doesn't, use the antibiotic eye drops, is what I would guess a physician would normally say. Because it's probably viral. And then the next one is babies should not eat honey. They strongly advise that babies eat honey because of the Clostridium botulinum. And symptoms of botulinum toxicity are the paralysis or the flaccid muscle state. And then why can they survive for long periods of time in honey? Because those form endospores. Those are endospore forming. So Clostridium, I'm not on the neuro section right now, but it used to be called Clostridium difficile. Now it's called Clostridioides difficile, but Clostridiums form endospores just like Clostridioides form endospores. And so that's why they tell children don't eat honey until they're when they're neonates all the way up until they're an infant, to stay away from honey because it can cause botulinum toxin. And then the last one is poliomyelitis, is a disease caused by poliovirus. Lose the ability to walk and lose function of their limbs. What's the tissue tropism? So this, you should have to remember that polio was in our nervous block. So anything having to do with the nervous system. Okay, so maybe you guys could give me some advice about how to help you memorize, like how to help you, because, so, if it were me, I would have taken the information that's highlighted and done note cards like this. So on the front, it would say MRSA. On this front, it would say maculopapular. So on the maculopapular, I would put measles. I wouldn't even have to remember rash, because you have to remember this is a maculopapular rash. But here, measles, Koplik spots. This is roseola, this is rubella, low virulent. So this would be on the back of my note card, this would be on the front of my note card. And you'd have to flip it both ways. Yeah.
The highlighting can be a bit misleading. There's small things on there that were on the quiz that weren't highlighted. Like the glass test wasn't highlighted, so people probably didn't go over that. The ringworm picture, there wasn't even a picture of ringworm on the slides, that kind of thing. It can be hard to say we need to study all these highlighted things, and then we get to the quiz and some of those things weren't on there to begin with.
Okay. I totally get that. That super helps.
The picture just wasn't included.
Oh,
In the slide too. The ringworm was highlighted on
Yeah, just the picture wasn't included, so it was, when you think of like pictures of rashes, you don't think like, oh, it's like some sort of tinea thing, because there wasn't pictures of that, so it's not the first thing that it goes to. It's kind of what I had personally.
there. Well, I just thought it was the only like circular rash. On the thing, so I just thought students would be able to
Yeah.
just come to that conclusion.
Yeah, and that does make sense. I totally get that, and I can include more pictures for sure, because I think that having just the more pictures that you, where are we? The more pictures that you can look at, the better. So here, viral, bacterial, lumbar puncture. Okay, yeah, so I don't think I even said, I didn't highlight glass test because I didn't write it, it was just here. Was it on the review section?
Was what, for what?
Let me look at that really quick.
I can look for you.
Yeah, if you guys have advice for the next ones coming up, please let me know.
I mean, Dr. Welch did go over the glass test. He said in the video, he's like, you guys need to know
So
that.
did Rosie Weaver.
Okay.
And you did talk about it right before we took the quiz too.
Yeah, but I didn't include it on the study guide here. Yeah, so just, I'll try 100% to be more clear, like I totally appreciate feedback, 100%. I think the pictures are difficult. I think what I assumed as far as the pictures go, which was probably not a good assumption, but I assumed because we went over that section when we went over fungal, I had a lot of pictures under the fungal lecture, but I could bring those back in. Let me make myself a note too. So under the fungal, when we talked about all of the tinnias, and we talked about the dermatophytes when we went over that section, I showed a lot of pictures of like what jock itch looks like, but I do think it's important to bring it back up again.
I think the deal is that when it says like memorize the pictures, and it says that we're gonna do it lecture 26 and 27, this set of pictures in there, the assumption is that it's gonna be somebody like those, and it's not like any of what I would assume.
Yeah. Yes, okay, and that's not, I don't think we have any more pictures. So definitely make sure that you know what, so let me think, are there any more pictures? We do nervous, we do cardiovascular, gastrointestinal, let me check. Okay, so just make sure that you, I think it will help also, really quick. So make sure that you attend Dr. Welsh's one-on-one, that you attend Dr. Rosemary's one-on-one on these ones, because it is tricky. Every student struggles with DDX, they just do. And I really wanna help you guys to succeed in this section, cause I mean, hypothetically, it's really one of the most important sections, because that's what's gonna happen, is your patient comes in with something and you're gonna have to recognize what it is. Yeah.
Sorry, I think it was normal, you might have gone over it. For the first like diagnostic one with the kid that had the complex spots, what else would you look for? Cause it said like always a rash that you see complex spots. I just wasn't sure what else you were supposed to look for.
So that one was a body rash. So your patient came in with like throat issues, and so you look at their throat and you're like, oh my gosh, they have complex spots. Do they have measles? So like, are
Right.
you looking for that maculopapular rash?
Okay.
Yeah. So that one was probably tricky because it was backwards. You know, it's like you're not looking for the maculopapular rash. Your patient comes in, the first thing you do is eyes, ears, nose, throat, and you look at their throat and you're like, oh, there's something wrong with their throat. Let me look at their body and see if they have a rash.
So the first question or the second part was measles?
The first question was maculopapular rash is what you're looking for, and measles is the organism.
Okay.
Measles is important.
Measles virus is it's an organism, but measles virus. So measles is the name of the disease, but also it's called measles virus. Yeah, yes. Yeah.
So, I always listen to Dr. Welsh's lecture because he records it, so it means I could do it when I am available.
Yeah.
But I'm working when Dr. Rosevear is doing his review, so
Mhm.
if he wanted to record it.
Yeah.
But it's like right before.
But if
Yeah,
somebody
but it would help
record
for
it
the
and post
final
it,
or whatever.
Yeah, I think especially since Dr. Myers is so amazing about recording, it was hugely helpful to me that you recorded the lab practical
Review.
review. I don't have to do all that again. That was incredibly helpful to me. So if it's help Dr. Myers out and record Dr. Rosevear or somebody, because that's.
He does more like Q&A though.
Q&A, but yeah,
it's more
I think
like
anybody.
he sits there and quizzes all of us versus going over everything.
Yeah, so if somebody could just do the voice recording, you know, like just voice record it, and then all you'd have to do is airdrop it to each other. I think that'd be hugely helpful for Dr. Myers, since it's amazing that
You
she
may not-
posts all those videos.
Usually if it's over like, I don't know, like 10 or 15 minutes, you can't airdrop, it has to be posted as something else, like the.
I do like 2-hour ones and airdrop them to students.
Oh.
Yeah, I think on that voice memos it's a good app on that, if you have an iPhone.
Oh, yeah, mine won't send to anything, like if it's over like half an hour, I think.
I think it's the file size, so if you go
Yeah.
lower quality, then it
Oh, yeah, that's probably.
Oh yeah, so help each other with that and see if you guys can get that going, because I think that'd be helpful. Yeah.
Yeah, and if it's helpful for anyone, I met with Dr. Welsh last night, and we went over some of the lab practical, and he posted like a study guide, slides, I think it's in week 15.
Yeah, I printed that.
Awesome. He posted it under modules.
I think so.
Awesome. Okay.
So then much videos,
Oh yeah.
he's awesome.
He's so
There's
great.
videos.
I know, I just love him to pieces. He's so good. He's,
Yeah.
you know,
Show me where in a minute.
he's so smart, and I think it's crazy, you know, just watching students. I don't know, I just get so much out of it. I think it's really neat. Like yesterday I had, my husband go and talk to my other class, because you guys already kind of know what you wanna do-ish, what you wanna be when you grow up, but the other class, they still have no clue. And so I had my husband come in and talk to that class. And it's just really neat to watch people like, okay, let me find myself and what I wanna do. So Dr. Welsh wasn't sure what he wanted to do, and he's like, maybe I'll be a teacher. And I was like, go big, you know, like just go bigger. And hopefully he's, you know, going for his PhD, but I don't know what he's gonna do, whatever. If he wants to be a teacher, amen. Like if that's his #1 goal, you know, that's great, but just never sell yourself short, I think is my point, is like, if you want to, you know, be the CEO of the hospital, do it. You know, if you want to go, you know, you're like, oh, well, I've wanted to go into nursing, but I actually want to be a doctor. Go for it. If you are going to be a rad tech and you want to be a nurse, if you whatever, just try not to sell yourself short. Actually, I have a really cool story about that this morning. I'll share my good news with you. Is that I am applying for a full-time job here, so I'm super excited about that. I'm pumped. Yeah. So I don't know if I'll get it, but I'm asking my thesis advisor from Harvard for a recommendation letter, and I haven't seen him in years, you know, and right when I wrote my thesis, I told, it was right at the beginning of COVID when my thesis was published. So I was like, he could not help me. He was traveling all over the world doing epidemiology for COVID, trying to figure out where it came from, trying to figure out who started, what are our numbers in Europe, what are our numbers in, he's from Colombia, so he spent a lot of time in South America. And so he couldn't help me finish, and I was really discouraged by it, you know, and so I was like, well, now I'm out of Harvard, I graduated, I will never go back because I wanted to publish my research. And then I just reached out to him and said, can you write me a recommendation letter? He's like, you have been on my mind since you graduated. I still want you to publish your research. So I'm like, so pumped. Yeah, so I don't know, I just think it's cool. It's just, you know, just thank you so much. I'm really excited about it actually, because I worked my butt off on it and I actually got a patent for it so nobody could use my research. And I spent all the money and all the time to get a patent on it, and I was like, okay, like, is this gonna happen? Is it not gonna happen? And then he just would never, he couldn't email me back. I emailed him like 10 times. So now he's like, I was like, do you even remember me? You know, he's got so many students, and he's like, you've been on my mind since then. So it's just, I'm so excited about it. Yeah.
That's great.
It's really
Question,
cool.
what is the research